Hello, 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 ATH Alice. Welcome to our weekly show. My name is Abby, your Healthy Living NP. How are you guys doing? Hope all is well. Hi, May. As you can see, the title of today's show is May Wrap Up. Alrighty, so we're in the last week of May 2025. So just wanted to go over a little bit of it's not going to be a long show today. Alrighty, so but I hope you guys had a beautiful weekend and all that. So we're finishing up the month of May. So just want to go back on the shows that I brought you because this was Women's Health Month. So week one of the month, I brought you important issues relating to women's health. We talked about making sure you're getting your physical, making sure you're getting your testing and screening everything that's related to women. You're getting your mammogram, depending on your age and the family history and all that. It's supposed to be every year. And if we have a first degree relative, when they were like your mother or your sisters, and also making sure it's your mother and father side. So it's not just one side. Making sure you're getting your mammogram and it's starting at age 40. If your parents or your mother or first degree relative was diagnosed like much earlier than that, tell your doctor about that because that puts you at a higher risk. Okay. We have average risk and then we have higher risk. Making sure as a woman also at a certain age 40 now, you get a colonoscopy and they can say, oh, I don't have any history of that. You and your doctor would determine whether, you can do the test. If you see that thing on TV, the Cologuard, where you can do the stool test. And then if that's negative, you can come and they can say, okay, yes, you're good for 3 years, but your doctor will determine what your risk factors is and say, no, you need to get a colonoscopy. Again, it's not pleasant, but little 30 minutes of discomfort can change the rest of your life. All right, getting your mammogram, also getting your pap smear as you turn age 21 as a female, regardless of your history of what are you involved in any kind of intimacy. All right, you're supposed to be getting your pap smear. That's when they could check for cervical cancer screening. You don't do it in early like they used to do it before because it was compromising the cervix. All right. So you go get your screening, and some doctors want it every year. Some doctors want it every 3 years. Your OBGYN will determine your risk factors and tell you how it's supposed to be. Okay. It can show you getting your heart checked. Okay. Because heart disease is the number one killer among women with all the other things combined. All right. So making sure you go in there, getting your EKG, talk to your doctor, talk about your medical history to your doctor. We'll be asking for your family history as well. So getting that information down. Did you ever have anybody who died suddenly in your family? Also, mainly like if it's like a heart related or like a brain related or stroke or stuff like that. Okay. So they're going to ask you those questions. If you had that in your family, bring that up when you go to go see your doctor. That doesn't mean everything that went on in your family that may happen to you, but that's your DNA. Okay, so those are your risk factors. Like I always say, we go on risk factors. Doesn't mean everything that's going to them will happen to you. Sometimes it could be like a lifestyle or where they live and all that. But the fact is, certain things we can say that's your DNA. You cannot change your DNA, all right, but you can modify again, going back, modifying the modifiables. Okay. Then I also brought you how to find a new doctor, tips of finding a new doctor. All right, that appears that's everybody. Don't just go ahead and change your doctors right away. Make sure you get all the information that you need, especially if you're in the middle of like getting clearance for surgery or they're getting medications that you need refills on, especially like for narcotics or things like that. So don't just go jump into another doctor. Right? Get all your information. Make sure you find another doctor first before you change your doctor. Okay, because the doctor that you may want may not be accepting patients at that time, or is not in your insurance plan, and then you don't want to be left without a doctor. Also, tell your doctor you're leaving. So if anything, you don't have to necessarily tell them, but just say I'm leaving. I need to have my records all set and all, and have that. You can have the hard copy of your records, or you can just have it directly sent. But make sure all of that is sent to the new doctor before you go ahead and say I'm done. All right. You can say I like my doctor. Why would I be changing doctor? Anything can happen. You can be moving. That doctor could leave the practice that you left, or that practice, entire practice could close down, or the doctor that you see at that practice could be leaving. Insurance issue, marital issues, death, and so many other things could happen that you need another doctor. So if you miss that, it's on the post Now below this one, a couple more posts down this way. So tips for finding a new doctor. So you can go back there and look. So we talk about the women's health issues, and we talk about tips for finding a new doctor. And then I also went in there and I talked about, I brought a lot of cardiovascular issues because I said, this is the year where May is Stroke Awareness Month. So I brought all this thing on Saturday. I brought like a marathon of shows last Saturday. Okay. So if you missed it, you can see the post below there. So your cholesterol level, your blood pressure level, your stress, diabetes, and all that affects your risk factors of getting a stroke, and also your family history too. Okay. And lifestyle change. So we talked about that. I brought somebody who's a stroke navigator on, and we talked about that. So it's in different posts below there, but the one that we talk about stroke directly is right below this one. Okay. Excuse me. So I brought that in. I'll be talking more about, of course, during the year, and I wanted to put the show on there about breast cancer. So I probably would show that one on Friday or Saturday too, because breast cancer is also a big thing when it comes to women's health. But I also touched on that too in the show that I brought you, Women's Health. All right. So, and I talked about watching your stress level, watching, protecting your mental health. Okay, if you have any issues that you feel like you're going to harm yourself or harm somebody, of course, you want to call 911 for that. Okay, but other than that, watch yourself. There are so many people out there who, setting, trying to like get you to where they want to see you down, 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 and all that. You do not let them. Okay. It doesn't mean that, oh yeah, you have this strong armor that you don't have any feelings and all that too, but you just got to stay strong. You just have to stay strong, because trust me, in as much as you put your armor out, they're trying every way to chip at it. And it's not just you, it could be millions of other people go through this and all. So you just have to be strong. Have somebody that you love, that you can trust, that you can tell your story, you can tell your secrets to, and that person will respect you enough to like keep those secrets and keep your stuff confidential. Of course, and people might say stuff and they'll continue saying things. And then at what point, eventually they're going to have to go on to something else, because guess what? Those people have their issues too, and their issues. But you said, okay, no, I'm just gonna leave it at that, because I am protecting my peace. And again, like I said, this is the year of living intentionally. Okay. And sometimes you can say, what does that mean too? It's like, okay, whatever it is you put your mind to, try not to get distracted. Okay. It's something that now you have a lot of distractions along the way. Don't think it's not going to happen, all that, but know where you are, keep keep the main thing, the main thing. All right. There's so many ways that people say, oh, look at this way. Oh, she didn't get to this point. Oh, he didn't get to this point. Or he thought he was going to be this, or he thought this, and by this time he would have been better than us, and whatever. Keep the main thing, the main thing. Okay. So, and I brought, like, again, all the shows and all, but I always also want to say thank you all so much for your love and support. Okay, they had a lot of new people along the way, a lot of people who are participating along the way, and some other people, like people inbox me and say, "Oh, thank you so much for, it's because some people don't like to put their comments on there too." So I understand that they would inbox me and say, "Thank you so much for what you're doing," and or they'll kind of inbox me on my personal page and all. So there's sometimes I don't, people call the phone directly. I don't answer any calls that I don't recognize. Okay, so just leave your comments in below, or you can just inbox me. Okay, so to all my faithful followers out there, don't think I don't, because I sometimes Facebook say make a post and teach and tell everybody thank you who did this week, or your high participants and all. But to all of you, whether you comment, whether you prayed for me, whether I pray for you, whether you just said you told somebody about Abby Tyler's Healthy Living page, whatever you did and all that too, I thank you all very much. I'm probably going to take a little break, maybe in July, to kind of take about maybe June, because everybody's doing the summer months now, so everybody's busy doing stuff, and also I probably might take a break, maybe a week or two, just to kind of relax and enjoy the summer a little bit. But I'll let you guys know if that's the case, and probably tape a show before, and then I have it ready. Okay, so I don't see any comments or any questions there. So, but thank you all. Go back and watch all the shows that I brought you. You can leave your comments there. You can leave your questions there. I'm still available to answer. If I don't answer right away, I may answer later on too, because I work. So, but I'll answer and all that again, and I'll try to bring show. And next month is Men's Health Month. Okay, so for the men in our family, the men in our lives, and all, brother, sister, husband, brother, sister, brothers, cousins, husbands, grandfathers, and all that too, and the men that we hold dear in our lives and all that. So we'll be bringing topics about that. Some of them already recorded, but we'll be bringing stuff about the men's health in our relationship and all that. So, okay. So thank you all very much for joining me in the month of May. Go back and watch the shows, And I thank you all. Please stay healthy. Please go to your doctor, get your physical done. Go there, do a follow up. If they tell you to do a follow up, if you wear glasses and you have diabetes and all, you should be going to get your eyes checked at least once a year. And also, as often if you have high blood pressure, if you don't have any of that, go get your eyes checked, because there are many eye diseases that start off and it doesn't show any signs and you may not know what's going on. So get your eyes checked. Go to your dentist, get your teeth checked and all that. Okay. You say, yeah, I brush my teeth and my teeth are nice and white and all, but there are other diseases too that affect your gum and other things that can also affect your heart health. So go to your dentist. Dentist can be a little expensive, a little bit. So I understand that. But they have a lot of places where you can pay, as you go. So go ahead and get your teeth fixed, get your make sure you're checking your gum and there's nothing there at the back of your tongue and all. So get that checked by a specialist. Okay, we will be a dentist. And exercise, go for a walk at least 30 minutes a day, at least 3 days a week. Exercise, dancing, doing all this stuff. This is what men and women are, but especially for my women out there, women friends out there. And know your history, know your family history, know your gynecological history, meaning the breast and anything below the pelvic, in the pelvic region. Okay, so know all of that. Ask your family, ask your mother, ask the other people, other women in your family, and check that. But most importantly, protect your mental health. Protect your mental health because if you're ain't straight, So, but and smile often, and don't let anybody get you down. Okay, they will try as much as possible, but don't let them get you down. And if you find yourself getting down, you know, cry about it, pray about it, and then get right back up. All right. But make sure you have people who you trust and people who are in your corner. All right. And it will tell you what you're doing wrong. Don't just get people who are just going to tell you what you want to hear, but it will tell you, it's like, yeah, we got you. We got you. We're here for you. Alrighty. So it's a busy day too because I have some other professional obligations that I have to attend to. So, but thank you all for watching. I really appreciate it. And I will see you guys. I will be doing Abby's Daily Dose during the week. So, but then we're starting the month of June next week. So enjoy the rest of May, and you guys will see me probably Thursday or Friday or so. Alrighty. And I will probably put the breast cancer show on too. All right. So let me see. Oh, now I'm ready to go. And I see a comment. Let me see here. Yep. Jackie Jackson said, yes, thanks for sharing. Thank you so much. Thank you so much, Jackie Jackson. I appreciate that. And we'll be looking forward to, family stuff and all that too. So I'll see you soon. And everybody else, all of you are watching now. And those of you who'll be watching later, I say thank you. I am on Tuesday. If you're new here, I'm on Tuesday at 7 p.m. Eastern every Tuesday. And then I do Abby's Daily Dose. Those are shorter videos during the week, and it's like 90 seconds long. Sometimes it's only like 30 seconds and all. Okay. So again, I didn't do my disclaimer, but whatever I say here shouldn't take the place of you seeing your own doctor because I'm not your doctor already. So you guys take care. Enjoy this spring weather. The weather was so beautiful over the weekend. So, but I'll see you guys during the week. All right. So take care now, and I'll talk to you later. Bye bye.